Hello, my name is Priyanka from Let's Update Language Academy, and here with me is
Shamali from Let's Update Language Academy.
And we are here today to present a roleplay card, indeed a long roleplay card, but we chose the latest roleplay card. The setting is home visit, but the introduction has got a difference here. Yes, when we check into the scenario, we'll understand that. So let's first explain the scenario.
Yeah,
okay?
right.
Yes, so this is here as a 8-year-old. With limited mobility, and she has got a pressure ulcer on her right hip for around 6 weeks ago, and some self-care measures were advised to her. Now the nurse has come to visit her to clean the sore and also to check the pressure ulcer, and the nurse has just examined the area and cleaned and dressed it. So the conversation begins after this examination and cleaning and dressing part. So we'll see how the introduction goes, right? So I'll be playing the role of the nurse. This young lady will be playing the role of the 80-year-old patient. Okay, so Shamli, are you ready?
Yeah, I'm ready.
Okay, so we'll start. Usually we have 3 minutes as a preparation time. But now we are right away starting to the role play card, and there are students who are often asked for the role play card. So if you can code this link to our Telegram group, we'll be providing you the full card for your practice. Okay, so you can check our Telegram group and you'll get the card. So yeah, we'll begin. Shamli, thank you for the cooperation. I've completed the dressing and cleaning of your pressure sore. So now I would like to ask you, how are you feeling from the last visit?
Yeah, actually I'm feeling good. My pain was subsided and generally I'm okay.
Alright, I'm very happy to hear that you have improved a lot. And what about the measures that I've advised to you, like self-care measures, like about the mobilization and the regular change of the position? Are you following that?
Yeah, I'm following all your instruction, but sometimes it's very difficult when I am sitting and I'm trying to change my position every half an hour.
Oh, I'm sorry to hear that. So I would also like to know about, are you using the cushion while you change the position to sit?
Yeah, to be honest, I'm not using the cushion because that material is quite slippery and it's very big too.
Alright, I have noted that. And what about the fluid intake? Are you taking a good amount of water?
Oh yeah, I'm drinking a lot of water.
That's very good. And yes, I've noted that you were not comfortable. You're not comfortable with a cushion. So can I know the reason why you find it very uncomfortable?
The cushion is too large and it's the material it's quite slippery and that make me uncomfortable, so that is why I don't like to use that cushion.
Alright, that's very clear and your concern is very genuine too. So what we can do is we can change the cushion. We'll consider your problem and we'll change the cushion, especially the size. We'll think about the appropriate size of the chair and also the material. If that is slippery, definitely it would be really hard for you to use. So we'll change the size and the material, so you feel a bit comfortable with the cushion. How does that sound to you?
Oh yeah, that sounds good.
Alright, and about my assessment, I have assessed your pressure sore, and it's so unfortunate that I couldn't find no or little improvement with your pressure sore.
Okay.
So possibly there is a chance of infection. So as a next step, what I'm planning is I'll take the swab from the sore and I'll move away with and move on with the analysis of the swab. Okay, and with that we'll be able to understand there's a need of any antibiotics and what is exactly the cause of this infection. Okay, is that okay for you?
That's okay, but sister, I don't really understand why this pressure sore is taking so long to heal. That makes me so sad.
I totally understand. You might be feeling very uncomfortable, but don't get depressed. That will be resolved. That's why we are taking different steps and analyzing, and we are thinking about the antibiotics. The reason for this slow healing is due to the reduced mobility. You're feeling a bit hard to mobilize, right? So that can be the reason, and also the reduced blood flow due to the less mobility. So we'll be analyzing it and resolving it soon, and with good progress, you're showing progress with the pain medication and other medication, you might find a betterment in the mobilization. Don't worry about that, okay?
Yeah, that's okay.
Okay, do you have any other question?
No, actually I understand now why my pressure source is taking a while to heal.
Okay.
And I will try all your instructions, and I really need a better recovery.
Okay.
So one more thing I want to talk to you, Dad. Is it your last visit or you will continue the home visits?
Oh, don't worry about that. Don't worry, dear. I'll be continuing the visit because you need monitoring, and the cleaning of the pressure ulcer is very important here. And as I said, I'll be analyzing it for further studies. So I'll be visiting you often, and I'll be taking care of you. Don't worry at all. Okay?
Okay.
Are you happy to hear that?
Oh, I'm very much happy now.
Okay. So can I start with the swab collection?
Yeah, sure.
Okay. Thank you.
Thank you.
So thank you. That was a presentation. I think it was for 5 minutes and it was a lengthy presentation. Students often come and said when they move into the examination hall, when they see the long, big role play card, they get a bit tensed. But this is actually quite simple if you can understand the story. So the story between the nurse and the 80-year-old and how they converse is what matter here. Okay, so Shamli was supporting very well. She was rightly saying all her concerns, and she was as an interlocutor perspective, she was a very good interlocutor who was really supporting with the right points. And coming to the candidate's perspective, the only thing that we should be very careful about is that we have to make the patient very comfortable. So, were you comfortable, Shamli?
Yeah.
Okay, so you can check into the card, and as I've mentioned, if you want the card, you can go to our Telegram group. You can quote this video, and we'll be providing you the card. You can practice. Make sure that you use all the empathetic sentences to make the candidate comfortable. Thank you so much.
Bye-bye.
Bye.